morning, everybody. Thank you all for being here. Last week, we reached a tragic and frustrating and unacceptable mark in our city with over 100 homicides. And that's a huge percentage of them are stemming from gun violence. An alarming number of them involve young people, and so many in some neighborhoods that people are afraid to sit on their porches or let their children play outside. And that clearly is unacceptable and has got to stop. While this spike is happening in cities across the United States, those of us at Metro Government are focused on what's happening here in our city and what we can do about it, and starting with addressing the root causes of violence. President Joe Biden last week announced a comprehensive strategy for tackling the unacceptable surge of violence in cities across our nation, and he specifically cited the need for a whole-of-government approach to this challenge. As you know, a whole-of-government strategy is what we're already embracing here in Louisville, and it's a strategy that's a huge part of our budget for the fiscal year that starts this Thursday, July the 1st. Because even as we acknowledge that our police officers perform a difficult and dangerous and essential job, we also have got to recognize that public safety is more than we can realistically expect the police or any single entity to address. So we as a government and as a society have to take more responsibility for creating the conditions necessary for public safety in every neighborhood. And certainly, as was underscored in the protests that we've seen in the wake of the deaths of Breonna Taylor and George Floyd and too many others, police reform is crucial to this work because it's necessary to have public trust. Already, our city has banned no-knock warrants, expanded rules on body camera, and an officer's duty to intervene. Our independent civilian review and accountability board is in place and working to select the right person to lead the Office of Inspector General. Our police chief, Erika, and her team are implementing recommendations from Hilliard Heintz's top-to-bottom review of LMPD. They're taking a hard look at how to create equitable policing, making changes in how we train, and how our officers engage with the public they've sworn to serve and protect. As I've said, the Hilliard Heinz report, along with the ongoing Department of Justice review of LMPD's pattern and practices, provide us a roadmap to meeting our goal of having one of the best police departments in the country. And you'll hear more from Chief Shields on that in a minute. But as a community, we must also recognize that the path to becoming a safer city and a city of racial justice and equity requires a broader focus. And our new budget has that focus, with investments in each of the 6 pillars we know are necessary for success: community mobilization, intervention, prevention, enforcement, organizational change, and reentry. Again, these mirror some of the focus areas outlined by President Biden last week. Our city budget quadruples our investment in violence prevention and capacity building programs from $5 million to $19 million, including critical work overseen by our Office for Safe and Healthy Neighborhoods. And in a moment, you'll hear from OSHN's Director, Monique Williams. We are also investing nearly $5 million in deflection and diversion programs, recognizing that some situations are best served by a social service response, particularly when dealing with people struggling with homelessness, mental health challenges, or substance abuse. Our Emergency Services Director, Jody Meiman, will talk a little bit more about those plans. This budget also invests in programs that help more of our youth find paths to success through the work of our Office of Youth Development and successful initiatives, including our Summer Works Job Program for youth and Reimage, which connects justice-involved youth to education, training, and careers. Reimage participants' recidivism rate in their first year is under 10%. The national average is 44%, so this is just more evidence that our Reimage program works. The budget also invests $3 million for Evolve 502, which provides scholarships that open the doors to college for every high school student in Jefferson County Public Schools. This is critical because data shows us that a post-secondary degree, whether it's a credential or a PhD, is the #1 disruptor of poverty. and disrupting poverty, providing an opportunity for all of our residents to be safe, healthy, and hopeful is key to preventing violence. And I certainly know that's a fact that Dr. Monique Williams agrees with, and I'd like for her to come up and talk more about the work of her office, the Office for Safe and Healthy Neighborhoods. Dr. Williams.
Thank you, Mayor. And so we know from decades of research that the most effective way to address the kind of violence that we're seeing is to employ a comprehensive public health strategy that centers the communities most impacted by violence and also, as the mayor mentioned, addresses root causes. And as he also discussed, us taking an approach that has a whole of government centering that allows for us to engage multiple sectors of our city so that we're able to target and then tackle multiple risk factors for violence across the social ecology, whether we're looking at individual level risk factors or societal level risk factors. And so this means that our strategies have to be supportive of those individual level strategies that allow for us to engage with those at highest risk for violence perpetration and victimization. And so we have to support our evidence-based, community-driven models for gun violence intervention that allows for us to both support and hold accountable those who are involved. We have to have a solid reentry system that allows for us to support those who are coming out of the criminal justice system to lessen the likelihood of reoffending. And then we also have to support and provide resources to tackle critical social issues because we know that those also contribute to violence, like dealing with community police relationships, access to housing, access to gainful employment, transportation issues, healthcare issues, systemic racism, which is a form of structural violence which creates the social conditions in which interpersonal violence is pervasive. And so our strategies have to be all-encompassing of all of these things that have been mentioned. And so for OSHN specifically, with the approved budget for the next year, this will allow for us to reorganize and expand our strategies that will help build the necessary infrastructure to deal with issues of violence in our city. And we're looking at doing so through the building out of community outreach and support networks within our priority communities around the city. A critical component of this is the coordinated functioning of our gun violence reduction strategies, which we know have shown remarkable success in disrupting cycles of violence, victimization, and also retaliation. And so these models include strategies like outreach, intensive case management, peer support, mentorship, jobs training, skills building, behavioral therapy and counseling, conflict mediation, as well as relocation for those who are not in safe conditions, and then coordinated crisis response. And so all of these approaches, when adequately resourced and implemented with fidelity, have proven to significantly reduce rates of non-fatal and fatal gun violence. And so alongside our intervention strategy, we also need a prevention strategy that mobilizes our community through capacity building, education, advocacy, and action. To that end, we will be using a community health development approach to assist communities in developing and implementing collaborative, community-driven, community-specific violence prevention frameworks. And this approach entails partnership building, assessment of current activities and existing resources, plan development, guided implementation, sustainability planning, and evaluation. The training and technical assistance will come from our office and partners, and we will serve to build community capacity for selecting, planning, and implementing the strategies that address interpersonal, relational, environmental, and/or social factors for violence. And so each community framework will touch multiple levels of the social ecology to ensure that we are creating holistic approaches to violence prevention. With this fund, we will also work to build the capacity of our organizations within the community to be more responsive, to ensure that what we're doing is comprehensive, socially just, grounded in the public health approach, and based in the evidence. And so these are some of the high-level strategies that we will be working on in this next year. And I just want to say thanks again to the mayor and to Metro Council.
Thank you, Dr. Williams. Appreciate all the good work there. As you can see, a lot is involved. Next, I invite Director Meiman to talk a little bit more about our diversion efforts, mindful that some of the specifics are still being worked out, but we're excited about this new initiative. Director Meiman.
Thank you, Mayor Fischer. Emergency management supports the city's investment in deflection and diversion programs, and one of the programs that we're going to be initiating is what we call a nurse triage program. This program uses nurses that are going to be stationed in the 911 communication center who could assist with diverting some calls for service where the person, they may need medical attention, but they don't necessarily need an ambulance to get them to where they need to go, or police involvement. This nurse acts as another provider in the chain of care. When a 911 medical call is made, the call taker will ask a set of questions, and to get them to answer to specifically see where their call needs to be routed from a predetermined protocol that will determine whether the person quickly needs an ambulance or can be sent to the nurse station for further questioning. This is one way we are getting the right response to specific calls. And some of the things that some of the examples that may be could go to this nurse is whether they truly do need an emergency ambulance, whether they may need a non-emergency ambulance. Maybe the person needs to get to an emergency room or an emergent care facility, but they don't necessarily need to go by ambulance, and we can arrange transportation for them if they don't have that transportation. Potentially the person could just need something that they could take care of at home. They need to be instructed on how to take care of themselves if they've got some type of minor injury or illness. And then if somebody could potentially be in need of a mental health professional, we can put them in touch with that, or we can actually contact their primary care physician with them on the line and get them the help that they need. Also, the deflection program that the mayor mentioned will also operate out of emergency services, and details about how it will work are still being developed. But I can tell you we look forward, obviously, to working with the partners that have been conducting the pilot program, University of Louisville, Spalding, and 7 county services, and we hope to have their recommendations of how the program might be operated within the next few weeks. And one other program to help public safety is we are able to begin our radio replacement program for our public safety agencies. The radios that they're currently using are beginning to end their life cycle, so we're going to be able to determine who needs those radios, and it'll help and create a safer communications procedure here in Jefferson County.
Thank you, Director Meiman. Now, one thing we've learned over the past several years is that the success of violence prevention depends on fidelity to the process and investments necessary to do the job. And of course, it's critical that our police department supports the work. So now we're going to hear from Chief Erika Shields, who can talk about this and the investments our new budget makes in LMPD. Chief?
Good morning. I'd like to start by thanking the mayor and city council for approving a budget that allows LMPD to target violent criminals in the most informed manner. A budget that is also constructed to begin addressing the numerous non-criminal demands that our police department tangles with each and every day. As policing in America moves forward, it is incumbent upon departments to ensure that the officers have critical technologies to make informed, sound decisions. Decisions that should simultaneously minimize the breadth of violent crime while also working to avert potential escalation of the incident. License plate readers, cameras, and gunshot detection combined provide essential real-time intelligence which allows for significantly quicker apprehension of violent offenders. It also allows for patterns of criminal behavior to be deciphered, and criminal conduct intercepted. And they also serve to present critical evidence that may otherwise not be gleaned. It is also important to note that these same technologies, which have been approved in the budget, provide for far greater transparency on the work that the men and women of LMPD are doing. Transparency to the public about our conduct. Cameras, whether they're a body-worn camera or an in-car camera, typically remove the gray that surrounds incidents that historically have been difficult to judge. But this is only half the battle for law enforcement. We have, in policing, become the front line of social work as well. And it, quite frankly, is not a space that we need to or want to lead in. It is a terrain that we are best suited to partner in. And thankfully, this budget acknowledges this critical need for change. Criminal activity associated with mental illness, homelessness, substance abuse, petty crimes, all have underlying drivers. And until we as a society commit ourselves to addressing these underlying drivers, we as law enforcement will continually be tasked with having to manage and handle what are truly socioeconomic based encounters that present the high probability of going sideways. Group violence intervention, GVI, the deflection model, both previously mentioned, have the capacity to begin to start addressing the real problems, the underlying problems. You're not going to see results in a fiscal year. We have allowed an issue, a socioeconomic issue, to grow exponentially over the last 25 years. It will take time. But what I will say is there will be progress. And with progress, you will see momentum start to be generated. And the more momentum that is generated, the greater the capacity of Louisville, Jefferson County, and our nation as a whole to become what we are. And that is a proud nation. Thank you. I appreciate it.
Thank you, Chief. And before we move on to any questions, I again want to thank the Metro Council, especially President David James, Budget Chair Bill Hollander, Vice Chair Kevin Kramer, for their partnership on this budget. And let me add that as we work together to make decisions on spending the $388 million that our city will receive as part of the American Rescue Plan, we continue to look for opportunities to commit additional resources to reimagine public safety and the related work of advancing the causes of racial equity and justice. So we've asked for the public to give us their ideas, and if you have transformational ideas on that point, I invite you to submit them at louisvilleky.gov/accelerator. And we need the community's help also to make us a safer community. So if you have any tips that you can help us solve open cases, I urge you all to call the anonymous LMPD tip line at 574-LMPD. Again, creating public safety is something that requires the combined efforts of social workers, nurses, community center staff, librarians, workforce trainers, and police officers, along with business leaders and community activists, faith leaders, and elected officials. The bottom line is it takes all of us. So let's work together to create the safe and equitable city that we all deserve. And that's the goal that we're going to continue to work forward toward each and every day here at Metro Government. With that, we'll be happy to take any questions. Yeah, well, first off, getting this budget passed was huge. I mean, quadrupling the amount of money in non-law enforcement response was a really big deal. So it will allow us to scale up some of the programs that we've seen success at. We mentioned reimage as one of those with just 10% recidivism rate. So how do we do more of that? Or our Pivot to Peace hospital-based intervention programs, again, a highly successful program. So we're going to be getting into a mode where we can scale these up and touch even more people. So that'd be one example. And if there are any others, Chief?
Oh, sure. Thanks, Mayor. So I think just speaking from LMPD's terrain, immediately what I would look at is, yes, there will be a portion of it that you can't capture. One of the programs that we're pursuing, and Officer Haygood, who's here, can speak at length about it, is associated with the GVI, the Group Violence Intervention, but it's truly if you have a death of a loved one, a son, a father, a parent, he and his team with OSHN go out and they will say, what do you need? and you will find individuals who may not have electricity, they may not have the capacity to pay for a funeral, they may not have food in the house. That is not going to be quantifiable, but the truth of the matter is, from LMPD's standpoint, that's more valuable than anything I can data drive. But separately, the custom notification piece that he's been working diligently on, and Dr. Williams has recently been able to hire some caseworkers so that they can further pick up some of the slack. That is really running interference on violence. So if you're shot, I'm going to, and I'm saying, do you realize, hey, where this is headed? And I'm talking to your mom, and I'm talking to your brother. That'll be tangible. And so we're tracking the connections we're making, because the data has shown where you make that simple notification, it has reduced shootings for those groups associated with that individual by 30%. So that'll be huge for us. The deflection model, when that gets up and running, I'm really hopeful that we see, by the time it gets running, we'll be benchmarking what is the reduction on mental illness calls, homeless calls, disturbance type calls that LMPD is not going to, or we go to and we don't end up handling, so that the person is redirected to a service provider that they need. So just speaking for my lane on this, my small lane on this, Dr. Williams has the much larger lane. There definitely are things, measurables, that we will be looking for to make sure that it's productive. And of course, always just reassessing, retooling, and improving. Thank you.
Well, a couple of those we talked about. So, for instance, the diversion and deflection program is about $5 million of that. So that means having the right responder at the right time with the right person. So that not only helps with responding and mitigating, but it also potentially keeps LMPD from having to make that call. So it frees up their resources to work on issues that they have skills that are more relevant to. Other areas have to do with scaling up the work that Dr. Williams is doing with safe and healthy neighborhoods. So I'll ask you to come up and talk a little bit more about some of those specific investments.
So, I mean, a bulk of what we're receiving is going to support the intervention work, where you're going to see some of what your question asked, some of that immediate intervention. How do we intervene in the next potential act of violence? But on the capacity building side, we have a smaller budget for our prevention activities, but with that, it is the community mobilization and building the capacity of community members to understand violence, how it happens, and why it's happening in the ways that we see it. And so that's a critical component of us being able to provide educational opportunities through our Ambassador Institute, but then also building out this capacity building institute for our city's grassroots organizations, because we have a lot of organizations in the city who are doing the work, who have the relationships in community, and who want to support making their communities better. They just don't have the adequate resources or the right, fiscal structure, or maybe they don't have a 501c3. And so I believe it's our job as a city to build the assets within our city, which brings direct resources to those communities that are suffering, but also positions those organizations too to vie for funding outside of the city, because they're now an established organization with the ability to go to a philanthropic organization or to vie for a state or other types of funding. And so that capacity building component is within our budget, but there's not a large amount that goes to that.
And on that, Gene, you all have the infographic up. Do they have on the back of that? So on the back of that sheet are the detailed. Okay, we'll give you the detailed breakdown by each one of the 6 pillars on where the investments are taking place.
I didn't mean to interrupt. For Director Meiman, I know some of the details are still being fleshed out over the next few months. Is this a team of one nurse potentially, or of multiple nurses
It'd be multiple nurses, but it'd be a certain time, certain time of day, there'll be more than, in the middle of the night or something. We staff, our staff is dictated by our call volume. So it just depends on the time of day as to how many nurses we'll actually have in the center.
This would be for Chief Shields. You talked a lot about the driving factors behind crime, which are being addressed in this budget, but you've also talked about the staffing issue that you have with LMPD. Now that the budget's passed, what is your timeline or vision for starting to tackle that issue of getting more officers on the street, particularly with the caseload that you're dealing with?
Well, I actually didn't talk about staffing today, so I'd just like to note that. But I got you. So what I would say is staffing is a bear, and it's a whole separate conversation. I think anyone that follows law enforcement knows that policing across the United States has taken a huge hit. Departments are struggling everywhere to hire. And so we are not an anomaly here in LMPD. And what you have is you have a very, very tight pool of candidates that every agency is vying for. And so we have our work cut out for us. I don't deny that. I think the main thing is policing has to rebrand itself and become desirable. It's not now. We've hit an all-time low, and we have to get into a space that, quite frankly, law enforcement's never been very good at, and that's marketing and showing and displaying what is so intriguing and rewarding about the profession. And so we're having to push ourselves into a space that we've just not had to do before. And so what you'll see here is you're going to see a lot of emphasis on getting the product, the branding out. The staffing does create an issue. We're working to see what our options are as far as bringing back retired officers, even if they're in a civilian capacity, to take up the slack of, there's certain things that you can only do if you're certified by the state. So they could definitely do a lot of the tracking of the files that come in for the hirees. So we're trying to complement existing staff with qualified retired staff where possible. So we're negotiating that. The negotiations on the salaries are still ongoing, so I'm hopeful about that. Because we're just in a space that it is a very difficult product to sell. And at a time when I want to be aggressively pursuing, obviously we need more minority candidates, particularly black officers on the police department. We're in a space, we're trying to find officers, period. But I have faith. I have faith that the profession will rebound, but it's a tough space to be in. But what I'll say is the one great thing about technology is it does shore up and complement people. And so it allows you to have real-time access, eyes on areas without having to have a person necessarily right there, which is huge. So I think that cities in particular are finding that it's very beneficial, cost efficient to have technologies so that you don't have to, because realistically you cannot have a cop on every street corner. Thanks.
All right, thank you all for coming out today. We'll see you next time.